Hello, good morning, good afternoon, good evening, wherever you're in the world. A very warm welcome to Meet Menaca to celebrate you. Episode 92 with Varicose veins with Mr. and Selva Theivacumar, who is a consultant surgeon, but we will come back to him. The talk show is 90 minutes, a multicultural show, which goes live every Sunday, UK time at 2 o'clock and Sri Lanka, India time at 6:30 in the evening in the summertime. We are here to celebrate each one of you by getting inspiring speakers. Some people have had extraordinary lives. Others have so much wisdom. They're experts in their field, and they come and share their knowledge to make a positive impact to you. Thank you so much for everyone who supports us week after week on the Zoom or on the Facebook. And thank you for those who subscribe to our YouTube channel and help us make this impact to a wider audience. So thank you to all. Please do subscribe to our channel. It helps us to get these messages across to a wider audience. Why have we invited Dr. Selva Theivacumar today to talk about it? He has an MBBS in Colombo, MRCS in Edinburgh, MD FRCS in England, and he's the head of the department and consultant vascular and endovascular surgeon at London Northwest University Hospital. So it's a great privilege to have Dr. Theivacumar on the show. A very warm welcome to you.
Thank you, Menaca.
Thank you.
Thank you. Thank you very much for inviting.
Thank you. It's a pleasure. Thank you so much. So without further ado, let's go into the topic of conversation today, which is varicose vein. Before we go into what is varicose veins, Dr. Theivacumar, can you just give some background? Could you explain to our audience what are the veins and what is the normal venous anatomy in the leg? We know that varicose vein is, 3 in 10 people, and women as us, we are more prone to it. But I think it's really important for us to understand what is normal before going into what causes these problems.
Absolutely. Thank you. It's a good question. I hope that explaining the anatomy will be helpful to understand the varicose veins and the treatment in future. As you know, the heart pumps the blood through the arteries all around the body because the arteries have high pressure because the heart is actually pumping into the arteries, and those arteries has to go through the smaller arteries and then capillaries and then go back to the veins. And the veins, by the time the blood comes to the vein, they are very low pressure, so therefore they have passive movement to go to take the blood from the feet or from the peripheries towards the heart. So therefore, to make sure that they are flowing nicely from the feet towards the heart upwards against the gravity, there are valves to make sure that the blood does not come in the wrong direction. So you can see in the leg, it's like a network, not only in the leg, everywhere in the body, the venous anatomy is as a network. It actually we can classify into deep veins. They are the main veins that takes the blood supply from the leg or any limbs towards the heart, and there are some superficial veins and there are perforating veins connecting those deep and superficial veins. You will see that varicose veins actually come from the superficial veins because of incompetent valves, and we'll talk about that maybe later. So from the leg, the blood has to go upwards against the gravity. So by walking, and the muscles pump, act like a pump, like we call it calf muscles as a peripheral hearts. So when we walk or run, the muscles pump the blood circulation upwards. The valves prevent blood coming downwards, and that's how the blood is being circulated throughout the body. So through the arteries, actively pumped by the heart, but through the veins, it's actually as a continuous flow, like a negative passive movement, helped by the calf muscles. So I think we need to know, first of all, the deep veins. Deep veins are the big veins that takes 90% of the blood circulation from the limbs towards the heart, and the superficial veins take the skin and the subcutaneous tissues, blood circulation towards the heart. Before they go into the deep veins through the perforating veins. And all these veins have valves. And then when the valves become incompetent, then they can have venous reflux and can have varicose veins.
You have explained varicose veins a bit already. So what is varicose veins? For people who don't know anything about it at all, what should they expect?
Varicose veins, definition is actually unsightly, dilated, tortuous, palpable veins or visible veins. They are exclusively on the lower limbs. Some people do get prominent veins in the trunk and the upper limbs, but mainly they are at lower limbs. So if you can see the diagram on the left side, that can show you the valves, when the healthy valves works and the veins don't dilate. But if you look at the diagram on the right side, you can see when the valves become incompetent, the blood comes pulled downwards because of the gravity, and therefore when it's happening for over a period of long time, they dilate, they became elongated, tortuous, and you can see one of the impressive varicose vein in the leg at the bottom picture on the right side. So varicose veins means palpable, visible, tortuous veins in the limbs, mainly in the lower leg, in the legs. That's what varicose veins means. And it can cause problem, and I'm sure Menaca will ask me appropriate questions to get to me the information.
Thank you so much, Dr. Theivacumar. This particular subject was requested by a member who comes in our audience very often. We'll go in depth as much as possible. Sure. So do all varicose veins cause symptoms? And how do we know varicose veins are the culprit of those symptoms? And what those symptoms varicose veins do not cause? Because it's like medical students, right? We go and we learn something and we feel we have everything in the world. What is your advice?
So yes, it's a long question, in 2-3 questions in one question. I'll try to answer. If I miss anything, please repeat the question. So to answer shortly, do all varicose veins need treatment? The answer is no. Varicose veins are fairly common, actually, slightly more in women, mainly because of childbirth, and therefore they have a chance. There's a small chance, higher chance of valves incompetence because of the childbearing uterus, heavy uterus pressing the deep veins in the tummy and the pelvis, and therefore there's slightly higher rate of varicose veins incidence in women, but not a big deal actually. There's about 40% of women tend to have varicose veins, and the men also slightly, not that it's about 35-40%, depending on what studies you're looking at it. Varicose veins can cause symptoms, but most of the symptoms, most of the patients do, some of the patients do not have any symptoms. They do have only a cosmetic appearance or unsightly appearance, which they are concerned about, and some of them are not bothered. But sometimes it can cause some symptoms because the blood is actually pooling downwards, especially when they stand up. So what happens is the venous blood pressure in the leg tend to increase with the day at a time. So we all know about the blood pressure that we talk about. That's about arterial blood pressure, what we all know. But venous blood pressure we don't normally measure, and venous pressure is quite low compared to arterial blood pressure. However, in the legs, the veins pressures could be high, especially if the valves are incompetent. So let the blood come in the wrong way, so their pressure build up. Therefore, the pressure in the tissues, venous pressure also in the tissues build up, so therefore they can cause some symptoms. The symptoms are quite vague. They are not specific symptoms for varicose veins, such as aching, particularly towards the end of the day, like a dull aching of the leg or heavy legs. That's what they often experience. And sometimes they can have throbbing of the vein because the vein is dilated. Any blood vessel does not have any nerve endings inside. However, they do have sensitive nerve endings of the outer wall. So when the vein is distended, they can cause some throbbing pain. So throbbing pain again can happen due to varicose veins. And sometimes people also get itching also because of blood pooling or the blood products pooling into the tissues. And all these symptoms are usually worse towards the end of the day. And when you wake up in the morning, because you usually lie down and wake up and there's no symptoms in the morning, the symptoms due to varicose veins tend to be worse at towards the end of the day. But itching sometimes seems to be pronounced at night time. Sometimes some people get cramps of the leg due to varicose veins, but remember there are lots of other reasons for the cramps as well. A lot of people have varicose vein on the right side, but the left side is cramp, or maybe the vice versa. So we need to make sure this is actually due to varicose vein or something else. But night cramps can be caused by varicose veins as well. So those are the symptoms that, generally speaking. However, the cosmetic appearance or unsightly appearance is also the problem, but it can cause some complication. I'm sure you're going to ask me about later. So I'm not going to go into the complications at the moment. So these are the symptoms that varicose vein can cause. But the most important thing is for you to understand, because these symptoms are non-specific, because achy leg and heavy legs can be due to lots of other things. Could be due to muscle problem, and therefore it is very important to realize or assess whether the varicose veins are the culprit of the symptoms before we offer treatment, because often we end up having unhappy experience or bad experience for the patient because they were expecting they may be having unrealistic expectation from the treatment, such as numbness of the leg. Numbness is generally a symptom of nerves, not because of the blood circulation, and therefore numbness is not a symptom of varicose veins. Similarly, a constant pain, the leg pain that is constant day and night or in the morning, that is extremely unlikely to be due to varicose veins. A knee giving way, a knee joint pain, those things are also unlikely to be due to varicose veins. That's why you need to see a consultant and see whether actually the varicose vein is the cause of your symptoms. Unless some people actually, of course, they want to have the treatment for cosmetic purpose. Then, of course, then again, it's the reason for treatment would be cosmetic. Unfortunately, the NHS in UK, they won't allow us to treat the patients for cosmetic reasons, but of course in private people do. But the NHS is allowing us to treat if it is a symptomatic varicose veins. So our job is to find out if the symptoms are due to varicose veins or not, which is sometimes also, tells the patients to wear some support stockings. If the support stockings actually helpful, the symptoms are improving, then actually I have more confidence that symptoms probably from the varicose veins. If appropriately measured and worn support stockings are not improving their symptoms, it's unlikely my treatment also wouldn't improve the symptoms. So that's how we sometimes identify whether the varicose veins are the culprit or something else causing the pain.
Sure. Thank you so much for that elaborate explanation. Thank you so much. Once we know that we do have a varicose vein, how do we classify in medical terms or understand the severity of it?
Yeah, so I think the varicose veins, when we say the appearance-wise, we classify. I think the varicose veins actually means palpable veins, and it is, you can visibly see. That's number one on the left side. And then there are two other types of veins that we have is in the middle and on the far right is the thread veins. They're tiny veins that they are actually called thread veins, but some people actually often classify everything together as varicose veins. We'll talk about thread veins a bit later, and that's where the classification this again, I simplified for the public audience, but we do have a bit slightly complicated classification for the medical professionals, but we call it C classification or clinical classification. Class 1 is actually the thread veins that we talk about, thread veins and reticular veins. They are the tiny vein that usually cosmetic implications. And if you see the class 2, but they are the palpable proper varicose veins, that C actually can be further subdivided into asymptomatic, That means they do not have any symptoms related to it, or symptomatic C2. That means symptoms are caused by varicose veins. C3 means they have associated with edema or swelling of the leg, particularly towards the end of the day. And in the morning, they have slim legs, and towards the end of the day, they have ankle swelling. So that means C3. And then class 4, if patients have varicose vein for a long time untreated, and they have near the ankle, you can see the pigmentation, brownish pigmentation can happen. It's more pronounced in white skinned people, but still even in dark skinned people, you can see them. So that skin pigmentation or eczema, people can have eczema due to varicose veins. That's called varicose eczema. So it's again important that if somebody has eczema all around the body and also in the leg, it may be difficult for us to know whether the varicose vein is the cause. But if they have got varicose veins and only that leg has eczema, then it's most likely that eczema is due to a varicose vein, and then they tend to get better if you treat varicose veins. So that is class 4, or that means they have skin changes. And then class 5 means actually, if the class 6 is if they have got venous ulcer, when it's active, we call it class 6. Once ulcer is healed, it's called class 5. So in that order, so class 1 means the thread veins. Class 2 means palpable varicose veins with or without symptoms. Class 3 means with swelling. Class 4 means with skin changes. Class 5 and 6 means ulcer. With ulcer, if it is healed, it's class 5. If it is active ulcer, we call it class 6. So this is how we classify the severity of the varicose vein on a clinical basis. We can also classify based on the etiology. I think probably for this particular purpose of topic, we don't need to go into that detail.
Thank you so much. We know so much about varicose vein now. So do all varicose vein need treatment? That is the main important question. You did say that if it's cosmetic, NHS won't fund, but otherwise, even if people do have symptoms, all the varicose vein, do we need treatment?
I think so. Thread veins definitely is mainly for cosmetic. I wouldn't advise them to have any treatment. What is most important thing is actually, if patients with thread veins only, if they have got leg pain, that pain cannot be due to thread veins. So if patients have pain, that must be due to something else. And if you end up treating the thread veins, they will definitely not have any improvement in their symptoms. So therefore, my advice would be not to have any treatment for thread veins unless, say, they really want for cosmetic reason. Then the purpose is different. Then actually we can treat them for cosmetic reason, and that would be some. We can look again if you want, and we can give some injection. There are some injection treatment available. There are surface laser treatment available. There are treatments available. But actually, what is health also means what is psychological benefit as well. Some people are cosmetically concerned, so therefore their psychology is affected. So therefore, some arguments that it should fund the NHS should fund, but NHS point blankly refused. So I think I understand because NHS is not without any bottom. There is a limitation, so we don't treat the NHS. Other than that, in other palpable varicose vein where you can actually visible and we can feel it, the C2 onwards, if they have symptoms, which I mentioned before, then they're worth seeking medical advice for treatment. And then C3 and C4 onwards, I think they should have treatment. So especially if they have ulcers or skin changes, then we should look into treat them. But not all the veins can be treated, though some of them can be complicated, because if they have got associated deep venous reflux, then we really can't treat in an easy, simple way. But anyone with C3 onwards, it's worth treating it. So C1 only for cosmetic, C2 if they have symptomatic, C3, 4, 5, and 6 should have their treatment.
Thank you so much. Next question is about flying. Now, people ask if they have varicose veins, can they fly, and do they have to take any special precautions?
Yeah, that's actually a very good question, because varicose veins, there is a slightly higher risk of developing DVT when you fly. Also, especially so if you have varicose veins and if you fly, there is a higher risk of deep vein thrombosis. So we talk about varicose veins. The varicose veins are actually the superficial veins dilatation. And when we talk about varicose veins, so but the deep veins or DVT, I think people should know often medical terms that we call it DVT or deep veins or clots in the legs. They often in the deep veins, not in the superficial veins, because superficial veins thrombus, that essentially means blood become solid and clotted off and thrombose. And when it happens in the deep veins are within the muscles, within the deep fascia. We call it deep vein thrombosis, and that is the one which can be dangerous because it can go to the lungs and cause pulmonary embolism, and therefore often people worry about it. So DVT can be a complication of varicose veins unless you take precautions when you fly. So I don't think some people actually advise not to fly, but I think it's not that you shouldn't fly, but you shouldn't fly without precautions. The precautions is actually you need to wear some plied stockings or the grade 2 support stockings we'll talk about later, to keep the compression stockings so that actually it acts like a one-way valve. If you think about the varicose veins are because of the faulty valve, and stockings actually act like a one big valve to encourage the blood flow from the feet to go upwards. The reason why people get blood clot is actually as long as the blood is circulating, blood will not form a clot. The blood will only form a clot if it is stagnant or if it pools inside the vein, and if it's not moving, then they tend to produce clots. So the stockings will actually help to keep the circulation from the feet towards the heart. And also they drink plenty of water. The other reason is because they are generally dehydrated when they are flying and they don't move, they are immobile. So they need to drink plenty of water, whatever liquid, but maybe alcohol may not really improve your water hydration because they tend to deplete the intravascular hydration, and then they tend to cause more clots. So water is the best thing actually, and then you need to move your ankle up and down when you are seated. So when you move your ankle up and down like this, so the calf muscles contract and relax. As you can see, as you have seen in the previous picture, the muscles actually pump, squeeze the vein, so the blood is actually going, taking the blood upwards. So moving ankle up and down, or as soon as possible, you walk around in the flight. So you need to do those things. Of course, somebody already have had deep vein thrombosis before, and then they should take anticoagulation or blood thinning medication to prevent deep vein thrombosis happening due to a flight. So if you have, in summary, if you have varicose veins and if you are flying, you should take some precautions. If you have never had very deep vein thrombosis before, then this mechanical prevention like stockings and taking adequate water and moving your ankle up and down, and stop bending your leg, squeezing the leg and bending the knee and the hip, and sitting down reading a paper for a long time. That's what actually it stagnates the blood and people get DVT. So avoid that. Stretch the leg, move your ankle up and down, walk around as much as you can, as soon as it's safe to do so. So those are the things actually will reduce the risk of deep vein thrombosis. Somebody who have already had deep vein thrombosis, they should take their warfarin or rivaroxaban, some form of blood thinning medication based on their advice. But there's some people actually take, even if they haven't had any deep vein thrombosis in the past, some people actually take aspirin sometimes. It's no harm, provided you haven't got any stomach ulcer or anything like that, just to keep your blood thin, because blood aspirin also thins the blood. But it's mainly for the arterial side rather than the venous side, but still there will be some help. So that's how I would prevent. But stockings is very important.
Thank you so much. So I'm sure like it's a holiday time, it's the right time to tell people what to do while flying. Thank you so much.
Thank you.
What is thread vein? Does this cause any symptoms? I know you went through it and you explained it already a bit.
So thread veins actually, it's just under the subcutaneous tissue. They're very tortuous, like tiny veins. They're actually less than a millimeter in size. So they definitely don't cause any symptoms. However, they can indicate there may be an underlying venous disease. So possibly if they're got, especially if they're at the lower leg or ankle, then it's maybe worth doing a scan to make sure that they haven't got any underneath incompetent veins. So when they have got faulty valves in the main axial vein that takes the blood upward, we call it incompetent. But these veins, the thread veins, are actually very superficial veins without any associated deep venous or axial vein reflux. Then therefore they're unlikely to cause any, they're very unlikely to cause any symptoms. And as I told you, probably we should not treat them unless for cosmetic reason. And if it is for cosmetic reason, then again, we should explain to them for cosmetic reason and the treatment side effects and the patient's preference actually then come into play whether to treat or not. Then again, it's a cost implication because it won't be available in the NHS. So therefore, people have to be very careful in assessing how much it costs and is it worthwhile having a treatment or not. So generally speaking, thread veins preferably not to treat only for cosmetic reasons.
Thank you so much, Dr. Theivacumar. You know, we have understood varicose veins so much better now. So what are the modern treatments? Because once someone unfortunately does get it, we will have to go through the treatment, isn't it? So what are the options?
Yeah, so I think when I was a medical student, even actually when I was even a junior doctor early stage, we did actually have open surgery. But actually, if you ask about treatment, there are many types. One is a conservative, that means not doing any intervention. This is what the slide that you are showing. So that compression hosiery, either by stockings or by using some wraps. There are nowadays the stockings, or also there are different types available: class 1, 2, and 3, and 4. Class is based on how much tightness it should be, and the class 1 is a very light one. That's the flight stockings, is actually class 1 support stockings. So if you can see the arrow, at the ankle level, they are providing higher pressure. And as it comes up, it's providing less pressure. So it has to be measured to the leg and then appropriate size for the patient. So when you wear the support stockings, it gives high pressure at the ankle and less pressure higher up. So it encourages the blood to go upward. So it acts like a one big valve. Sometimes people can't really, especially elderly people, can't bend and wear the stockings. So they have nowadays wraps available. There are commercially available easy wrap, medi wrap, extra light. There are lots of wraps available. So that can be used as well as a compression hosiery. And then the old traditional method, then we come to intervention. The intervention actually, open surgery is actually almost nobody ever does it anymore, unless it's very rarely a rare situation. I mean, to be honest, for the last 10 years, I probably have done 1 or 2 open surgery nowadays. But most of the 99% of the treatments are done minimally invasive or needle keyhole technique. Actually, it's a needle hole technique. This actually all started from year 2001 or 2. All these minimally invasive treatment started to take off, but it took about 10 years to NICE guidelines to approve it. So now at the moment, the golden treatment is actually endothermal ablation. So either using laser treatment or something called radio frequency ablation, we produce heat inside the vein. Essentially, we cannulate the vein using an ultrasound scan and pass a heating probe inside the vein and give some local anesthetic injections to around the vein to protect the veins from so to separate the veins from the other surrounding tissues, and then burn the veins from within. That means it essentially undergo heat damage, and then the body will absorb and then replace with the scar tissue. We used to strip them. We make a cut in the groin and strip the vein in the past, but nowadays we use endovenous techniques, either endovenous laser treatment, we call it EVLA, or endovenous radiofrequency ablation. That is the gold standard treatment at the moment. But there are even more even modern treatments available nowadays called endovenous chemical ablation. So this picture actually shows about how do we do under local anesthesia using ultrasound scan, cannulate the vein and pass the laser fiber or radiofrequency fiber and give some injections, local anesthetic injection, as you can see in picture 3, and then we essentially burn the vein and destroy the vein. So those are the endothermal. And then, there are chemical ablation, endovenous chemical ablation. So this, what you see is actually ultrasound guided foam sclerotherapy. So if we inject some chemicals, irritant chemicals, into the incompetent or faulty vein, and to damage the intima, the inner lining of the vein, and then we keep the leg compressed, and therefore the theory is that the veins will undergo sclerosis or fibrosis later with time. And you can see on the right side there are some injection treatment for or thread veins. That's I think I wanted to show you the same form sclerotherapy. So it's all part of the modern. The sclerotherapy was there for a long time. Actually, it's not modern, but the ultrasound guided foam sclerotherapy is actually a latest modification of the very old treatment. The one of the very latest one is actually this endovenous glue therapy. So we started putting glue inside the vein, because the only thing is for endovenous thermal ablation, you need to inject along the vein to give something called tumescent anesthesia to separate the vein from the surrounding tissues so that the heat energy wouldn't destroy the surrounding tissue. So, but actually that giving injection will be multiple injections. Some patients find it difficult to tolerate that, and therefore difficult to do under local anesthesia, particularly when the patient is needle phobic. And therefore the further invention happened was endovenous glue. So you access the vein and put some glue and keep it compressed with the ultrasound scan guidance, under the ultrasound guidance, and every 3 centimeter segment by segment you seal it. So essentially you seal the vein using glue inside. That is the latest development, but still the standard treatment for varicose vein is endothermal laser or radiofrequency ablation due to heat energy. So I think the modern treatment is actually using keyhole techniques. So we don't do open surgery rarely, unless it happens again with the keyhole and the vein is so big that you actually, even a laser treatment wouldn't seal, then you may have to do open surgery. But other than that, most of the patients can be treated with this modern treatment using endovenous laser or thermal ablation or chemical ablation. This is actually done as a day case procedure under local anesthesia. You come and have it done, go home after a cup of tea or coffee. And it's really reasonably straightforward, and the complication rates are really low. The infection rate is really low. So compared to a surgical technique, although I remember when I was a medical student, we used to keep the patient for weeks after the open surgery, and nowadays we don't even admit them. We discharge them on the same day.
Thank you so much, Dr. Theivacumar. I like the fact how you made it sound like just going for an afternoon tea. So
No, that's fine.
Thank you so much. A segment of population always are scared of any treatment for that matter, right? Not only for varicose vein, for many things. Why should they have this treatment? If they don't have the treatment, what will happen?
So I think if you don't treat varicose veins, the honest answer is actually the varicose veins are not going to get better on its own. They are likely to get worse, but may not be as one would think. Sometime after 20 years, still have the same varicose vein, not much different. So it's very difficult to predict how an individual patient will behave or would lead to in long term. But there are some patients actually lead to some complications. So one of the complications is actually what we call this eczema, the venous eczema we talk about, the skin changes. And near just above the ankle or the inner side of the ankle, the skin become discolored and it become like a fibrous tissue, like a hard. If you see, compare to the other side, and you will see it's actually like a harder than before, or compared to the other side if you don't have varicose vein on the other side. So that's called lipodermatosclerosis. That means hardening of the skin. Then it leads to ulceration. So essentially, it can lead to a venous ulceration, and very difficult to treat. Of course, we can treat them, but it's also very costly and very inconvenient for the patients. But do every patient will lead to varicose vein venous ulcers? No, not everyone. But some of them can lead to. But it's very difficult to predict who. But if they have got no skin changes when they are 70, 80 years old, then they are not likely to get ulcers in their lifetime. But if somebody at 30, 40 years old, if they got some skin changes, then when they become 50, 60, they are likely to get ulcers. So the severity, so patients with thread veins are never going to get ulcers, provided they remain same with the thread veins, unless in the classification, if you remember, if the C1 and C2 are unlikely to get any complication, but C3 onwards likely to get complications. So therefore, that's the reason why NHS is happy to offer treatment for the severe degree varicose veins. We said venous skin changes, eczema, skin changes, ulcers can happen as a complication. And sometimes also what we call phlebitis. So the phlebitis is actually a picture of phlebitis. So it's called thrombophlebitis. Essentially, a varicose veins you should be able to feel it, and it's actually soft. And you can feel, if you palpate the varicose vein, you can actually feel that's actually you can squeeze it very well. But if that means the blood is actually still flowing, but if the blood in the varicose veins stays and become thrombosed or become solid, then when we call it phlebitis. So that means it forms a clot. The clot actually, when the blood is a liquid, as you all know, when the blood actually become a clot, we call inside the vessel, we call thrombosis. When the blood forms a clot outside the blood, we call it blood clot. For layman term, it's actually blood clot, but actually, if it happens within the blood vessels, we call it thrombosis. So when the varicose vein thrombose, we call it thrombophlebitis, because itis means inflammation. So the thrombose clot, the blood clot, actually irritates the vein wall and forms sets off an inflammatory reaction, and therefore it became painful, tender, red, and hot. So it looks like an inflammation. So sometimes patients confuse this as an infection. Actually, most of the thrombophlebitis are not infection. You really don't need antibiotics. Sometimes if you have an infection in the legs due to cellulitis or something, if you happen to have varicose veins, they can thrombose secondary to the infection, then you need an antibiotics. But a primary phlebitis, most of the time, you don't need an antibiotic. You only need an anti-inflammatory like brufen or ibuprofen or something like that, or maybe hydroxyurea cream. So that's how you need to manage the phlebitis. So it's the same pathology like a DVT actually, but DVT means clots forming in the deep veins. And they are with higher risk because they can travel to lungs. But the thrombophlebitis don't. They are outside they are the superficial veins. They're actually very painful. It might take very long months to get better, and it will be tender to touch. And this sort of complication can cause constant pain. Remember, I told you varicose vein never cause constant pain unless they become phlebitis. So normally, otherwise, they only get heaviness towards the end of the day. But if it is painful all the time, and if it is tender to touch and it's really red and hot, that is phlebitis. That complication can happen due to varicose if you don't treat varicose veins. But actually, if it happens once, then probably worth treating it, because it can happen again and again. So that's the other complication that we have seen. And also sometimes you can have bleeding due to varicose veins. So bleeding generally happens in an elderly patients who have thin skin, and the varicose vein is actually pushed the skin for a long time. The skin is overlying skin is so thin, And as you know, the varicose vein can cause some itching and dry skin. So they tend to scratch without their knowledge, and then they start bleeding. Surprisingly, it's very painless bleeding. They wouldn't notice that. They only notice suddenly, there's a pool of blood. So when they have a bath or anything like that, you don't even realize, because it's not a painful bleeding. So therefore, to prevent those things, it may be worth treating it. If the patient already had bleeding, then we tend to treat the underlying cause to prevent future bleeding. So those are, so in summary, you can have skin changes, venous eczema or ulceration, bleeding or phlebitis. These are the complications of untreated varicose veins.
Thank you so much. If we do have the treatment, then what are the complications? Because most of the treatments do have some complications.
Because any treatment, no treatment is actually without any risk. As you know, you walk along the street, you actually have the risk of something. So what complication happens, it depends on what treatment we are offering to a patient. So with the compression stockings, actually compression stockings and compression hosiery is not a it's like a kind of controlling situation. Sometimes we do that because we think the patient is actually too unwell, or the situation is actually very difficult to treat them. So therefore we say, okay, conservative management. Or we might say conservative management initially to see actually the symptoms would actually benefit from or not. So that's what we started off with, conservative management. So there's not much of complication from the conservative management, except that not everyone actually happy to wear them, especially in the summertime, and elderly people can't actually wear them. There are some gadgets available to help them wearing it, but it sometimes can be helpful, can be difficult. So if you do endothermal ablations, the complications can be due to, because there are nerves running closer to the veins. Because these veins, varicose veins, are superficial veins, all the nerves that are superficial nerves, that means they supplies to the skin. So they are sensory nerves, not the motor nerves. So unlikely that you will have any problem with the motor nerves, except one behind the knee, but I don't think I need to go into that detail. But generally speaking, nerve damage can cause some patchy numbness or some shooting pains. So the nerve damage can happen. And varicose veins can come back, recurrent. I think it's fairly common, especially if a young person is having a treatment. It's very likely that during their lifetime they will have some recurrence of varicose vein. Whether it's worse than before, less than before, very difficult to predict. So recurrence or the residual veins, not all the veins will disappear. Some of the veins will be left behind. And of course, immediately after the treatment, there will be some bruising and some swelling and some pain will be there. So those are the symptoms or complications. In terms of, because we use thermal energy, in the initial part of the time, we started using under the general anesthesia. We put the patient to sleep and do it because initial during the training, not training, because when we started developing it, not everyone is actually capable of doing tumors and anesthesia with less pain. So patients have a lot of pain, and they put the patient to sleep, and they didn't give enough protection. So there are some skin burn conditions in the early period of time. So that actually nowadays very rarely you see any skin burn or anything like that. However, the skin blistering can happen in the treated area sometimes, or bruising will happen. So those are for endovenous thermal ablation. For chemical ablation, actually that means either glue or sclerotherapy. So the complication, actually thrombophlebitis, can happen after the treatment. Because the way that we treat, actually, we actually damage the inner lining of the vein, and then we prevent the blood circulating, and therefore the varicose veins actually collect some blood, and then they don't circulate, so they become clogged, and therefore they became phlebitis. Of course, when the phlebitis settle down, they all get better, but initially it can be very painful for a few months sometimes. Not everyone, but some people do get it. So those are the side effects and the complications of the treatment. But there are a few complications can happen, like a very serious complication, especially after the foam sclerotherapy. there are in 1 or 2 reported cases in the whole world about stroke. I wouldn't really worry too much about it because they're extremely rare. What happened was in that is one case was reported from Ireland because they have injected too much volume of foam, and that particular person has had a hole in the heart, and so we injected vein into the vein that go into the deep vein, go into the heart, rather than going to the lungs. It went into the left heart and then go into the brain and had a stroke. Well, that was temporary anyway. So anyway, those serious complications can happen. But if you are careful, extremely rare. I don't think one should worry about stroke and therefore not having treatment. But that's maybe just any treatment can have serious complication, but the percentage is extremely low.
Sure. Thank you so much. As we are coming closer to the time, so I'm going to try to manage the time. What to expect from the treatment, and is there any cure for varicose veins as such?
So we have seen varicose veins doesn't cause all the symptoms. So I often tell the patients that anything that caused by varicose veins will get better. Anything that is not caused by varicose vein will not get better. So simply numbness and leg giving way is not going to get better by treating varicose veins. So of course, the complications also can be expected after the treatment. Some of them everyone will have it, like a bruising and some swelling and pain. Everyone will have it for some time, for a week or two. And the treated vein will become like a tender before it becomes absorbed by the body and disappears with time. So, and some of the veins, not all the veins will disappear. I told them mainly about 80 to 90% of the veins will disappear, but some of the veins can remain as a residual veins. And unfortunately, if you ask me the honest question, I answered whether we can cure. I think there's no cure. We can only control it because veins can come back, because veins are, lots of veins are in the body like a network, because we ablate the vein, that means we remove the vein, so we destroy the vein, but the blood will go through lots of other network of veins. So therefore, those veins can become incompetent and become varicose veins. So therefore, I think the cure is where I wouldn't be able to use it.
Thank you so much. Can someone prevent getting, we can't cure it, can we prevent getting the varicose veins?
Unfortunately, no, I don't think there's no prevention. I think if you ask me, the standing jobs, people who have jobs on standing up for a long time, I don't think they will develop, but once they develop, they don't get better, or it will get worse quicker. But it does not mean that you should really do a job lying down. No, you can't really do. So a short answer whether we can prevent varicose vein or recurrence, unfortunately, there are no proven method to prevent it. So stockings also can control it, but it wouldn't prevent.
Okay, thank you so much. You have told us so much information within this hour. So what are the 5 most important things one should remember, or you would like the audience to remember?
I think one should remember the varicose veins are fairly common. And not everyone needs treatment. However, there are symptoms related to varicose veins. If they have got symptoms, which I mentioned, like aching towards the end of the day, or throbbing when you stand up for a long time, or itching, or if they have got any evidence of higher grade varicosities, like skin changes or pigmentation, eczema, or ulcers, definitely, then they should have a treatment. So that's number one. I think in those days, when you have ulcers, we don't normally treat them. We normally put them on a bandage and treat the veins later. But nowadays, we put them on the bandage, but also we treat them because we can. With the laser treatment, risk of infection is very low. That's number one. So remember, how do we know whether symptoms are due to varicose veins? Most of the symptoms are worse towards the end of the day. So if somebody wake up with a painful leg, it's extremely unlikely that is due to varicose veins. So you should be able to somewhat figure out what sort of symptoms could be varicose veins, and better to know what symptoms are not due to varicose vein, which I mentioned before. So untreated varicose vein can cause complications. That's what we mentioned about eczema, phlebitis, ulcers, DVT, especially when you fly. So you have to be very careful when you fly, and then take precautions. And remember, there are nowadays treatments available under local anesthesia as a day case procedure. Most of them it can tolerate very well. Although I'm not lying, it won't be pain-free because injections are injection, but most people tolerate very well. I think that's all, and that's all I can say about these five points.
Thank you so much. You've covered so much. Thank you. I'm sure we have a better knowledge about varicose vein for sure. What has been your experience on this talk show, if I can ask?
Yeah, that's actually very, very pleasant, and I'm sure, hopefully, a lot of people will watch and might get benefit. I think it's really a great initiative. Thank you very much, man. It's really good. I had a happy experience. That's what it matters, and I hope that listeners understood and they had a happy experience as well. So I think it will be an online learning platform for patients. So I think it's a really great work. Thank you very much. Thank you so much, Menaca.
Thank you. We're humbled to have you. Thank you so much. I'm sure everybody will agree. We have learned a lot because varicose veins, for whatever reason, doesn't get discussed very often. So yeah. It is really important for people to know what to look for, how to approach it, and what treatments are available, and what not to do if it is not varicose veins or it's not needed. So it's really an important topic. Thank you so much once again. We learned a lot. Following tradition, I'm going to announce the next week's speaker. We are going to be talking about cancer screening and gynecology by Mr. Junqing Wong. And he's a consultant optician and gynecologist at Newham Hospital, Newham University Hospital. So looking forward to him coming and talking about it, particularly certain communities like ours, where I belong as well. We don't talk about these things very often. So I think it is important time to start talking about these important topics. Now over to Lakshmi Veladar to give the vote of thanks.
Very good afternoon to all. First of all, happy Father's Day. Especially, you have done this program on the Father's Day. I think that's absolutely amazing. And I can see there are quite a lot of participants on today's event. So amazing. So on behalf of everyone, Meet my Menaca talk show. So it's our privilege to, have you on the show, Dr. Theivacumar. Thank you very much for accepting our invitation and joining us for this special day. I think we have all agreed that, we learned a lot about varicose vein. Varicose vein among women, as you said, is probably one of the although it may sound cosmetic and we all feel on a summer's day, we find it very difficult to kind of, match some of our dresses and things like that, I'm sure. And especially in our pregnant women, obviously, I have many patients complaining, especially after multiple births and things like that. So they do suffer a lot, and it can be quite debilitating for them, especially if their work involves standing up and things like that. So thank you for educating everybody. And and equally, I thank Menaca for making this, as usual, making this talk show, very interesting. And it's absolutely amazing to hear that. Thank you so much, Menaca and Dr. Theivacumar. Thank you very much.
Thank you.
Thank you, Lakshmi. I should have introduced as Dr. Lakshmi Veladar. This is what happens when they become my friends. Thank you so much. Thank you so much once again, Dr. Theivacumar. Immensely grateful. For people who are on the show, please wait. We are going to go to the Q&A from you in a minute. For people who are on the Facebook, it is coming to that time to say goodbye. Next time, same place, we will be talking about cancer screening and gynecology with Mr. Junqing Wong, who is a consultant obstetrician and gynecologist at Newham University Hospital. Until then, stay safe, be happy, and keep smiling.